Good afternoon and welcome to Waco Rotary. Today we are welcoming the new director of Waco-McLennan County Public Health District, LaShonda Malrey-Horne, to our meeting. As a reminder, we are engaging in our live meeting traditions while we're meeting virtually to get everyone in the spirit of Rotary. So we hope you enjoy this rendition of the national anthem, followed by the pledge and our invocation.
All right, I'm having technical difficulties. Can we go to the pledge?
We sure can. We sure can. Okay, sorry about that. So we may have to go through that today. Let's go to the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And if you'll bow your heads with me for our invocation. As we gather today in spirit, please help guide us in our thinking. Although we miss our fellowship, help us remember those who are not able to ever meet with friends and family because they live in a place that is not free. Help us to be well so that we can serve others, and keep us in the spirit of service above self as we go about our lives. Amen. We're glad everybody can join us today. As a reminder, we are continuing to engage student guests so that we can tell young people in our community about civic clubs and about Waco Rotary and what we do, and also so we can hear a little bit about what our students are doing. And as we have seen in our meetings, we've heard from students throughout McLennan County, and we have seen how they're thriving during this time that's been very challenging for all of us. We're pleased to have student guests from MCC today, and I know we've got Kay Paul Holt from the board, and I saw Dr. McCowan and Kim Patterson. So several MCC folks are in our audience today, and we're going to hear from, we'll be happy to hear from these two great students from MCC.
Hi Waco Rotarians, my name is Killian Hutchison and I'm an MCC nursing student in my first semester. I graduated midway in 2019 and I did prerequisite classes for a year at MCC before starting the nursing program. I hope to one day be as good as a nurse as I can be for the city of Waco, for our community, and to serve others just as well as I've been served, if not better. And thank you for inviting me to be your student guest. I wish I could have been there in person, but maybe after COVID and these crazy times. Yeah, I really appreciate everything y'all do for our community, and just thank you. Thanks for having me. All right.
Hello, Waco Rotarians. My name is Glenn Cashaw, and I graduated Waco High School in 2018. I am currently a student at MCC, where I am involved with Presidential Scholars, and I am also part of the Men of Color organization. My family includes my mother, Erica Palmer, and my dad, Glenn Cashaw. My future plans are to work cybersecurity and informational technology one day. Thank you for selecting me to be your student guest, and have a great day.
Thank you, and we thank those students and for everybody at MCC that's doing what they can to support them this year. We are going to have our program next. I'm going to introduce our chair of the day, and just as a reminder to everyone, because we're meeting virtually, we do have some new members. Instead of doing networking like we would do live in the club, we are presenting information about various Rotarians as they present during our meetings. And so today, Diane Sawyer agreed to be our chair of the day, and so I'm going to introduce her, and then she's going to introduce our speaker. So Diane, you can see a slide with a lot about her career there, what she's done. She practiced as a local OB-GYN known by many people with a 25-year career here in Waco. She's always served her community as a part of Hillcrest Medical Center Board and the Hillcrest Hospital Medical Staff President while practicing as a physician, and then as a part of many local boards. Those of you who have participated in various, you can see all of the boards that she served on. So I know that many Rotarians have worked with her and served with her in that capacity as well. In her retirement, she has served on the board of Waco Rotary and been a point person for our well project in Africa. And those of us who serve on the board know what kind of patience it takes. Waco Rotary International is a very large and powerful organization, but it's very bureaucratic. And Diane has had very strong patience with them and seen it through, and we've seen a successful project because of her dedication to doing that. So we're very appreciative to her, and I'm going to turn it over to Diane to introduce our speaker today.
Right. Well, I am pleased to introduce our speaker today, who happens to be a fellow alumnus from my alma mater. LaShonda Malrey-Horne earned her Bachelor of Science degree in Health Sciences from Texas Women's University, and she followed this up with a master's degree at A.T. Still University in Kirksville, Missouri. She's worked in public health for over 15 years and is a Master Certified Health Education Specialist. Most recently, she served as the Section Chief for the Regional Operations at Texas Department of State Health Services in Tyler, where she guided that area's response to COVID-19 pandemic. Before working for them, Malrey-Horne served as the Residency and Education Program Manager for University of Texas Health Sciences at Tyler's Occupational Medicine Residency Program. She also oversaw the Department of Community Health and Preventive Medicine there, along with co-founding Rose City Trekkers, a branch of the Girl Trek. After comprehensive search process, Malrey-Horne was confirmed by the McLennan County Health District Board in January and began work as Director of Public Health Services March 1st. Welcome to Rotary in Waco, LaShonda.
Thank you so much for that introduction, Diane. When I saw that you were a fellow Pioneer woman, I got a little bit excited. I don't meet too many TW alum, so it's great to meet you. And thank you, Ashley, for this invitation, and to everyone on this Zoom. Thank you guys for being here. I just want to spend a few minutes talking to you all about my perspectives on public health and what you can look forward to with the health district as the years progress. I'm excited to be with you all. Let's see if I can get this going. So a little bit about me. East Texas is my home. I was born and raised in the Kilgore, Texas area, and I went to high school there in a small district called Gladewater-Sabine Independent School District. And I have been in East Texas for the last 15 years. After finishing my bachelor's degree, I moved back home, and I was able to have a wonderful career here in Northeast Texas with several different organizations. I am a Master Certified Health Education Specialist, and that's a credential that about 3,000 people across this country have, so I'm pretty proud of that. So my experiences in community and public health include experience at the UT Health Science Center at Tyler, like Diane mentioned, the Texas Department of State Health Services, at-home healthcare, and Wellness Point, which is a FQHC in our area. So I talk about my experiences because they're broad and diverse, and they're not just focused on one thing. And I kind of dabbled in a few different fields or in a few different areas of community and public health intentionally, because I want to make sure I landed in something that I really, really enjoyed. So my first job out of college, being at Wellness Point, was a lot of fun. I got to learn a little bit about what community and public health was, and a whole lot about what not to do with large federal grants. So it was pretty eye-opening. And in at-home healthcare, I got to learn a lot about for-profit healthcare, which is something I had no experience in. It really helped me understand how public health and the traditional healthcare environment work hand in hand. So that was a really good time to be a part of that organization. So why public health? There's 3 different pictures on here, and I'll tell you guys a little bit about each one. The first picture is an example or a diagram of what happens when a person has tuberculosis. Typically, you experience fever, night sweats, persistent coughs, sometimes bloody phlegm, chest pain, and shortness of breath. Well, in the summer of 1999, I started having all of these symptoms. And at first, it felt like just the flu or regular common cold, but it just persisted and hung on for months. My primary care physician said I had pneumonia. I went through a round of antibiotics, and then he said I had pneumonia again, went through another round of antibiotics. And one August, I couldn't get out of bed, and it was in the middle of the day, and the air was down at about 60 in my parents' house, and I was sweating like crazy, and I knew something was not right. So after being admitted into the Good Shepherd Medical Center in Longview, I spent 3 days on antivirals, antibacterials, and antifungals to try to figure out exactly what was wrong with this seemingly healthy 19-year-old freshman college student. And my pulmonologist, Dr. Yu, told me about 4 days in that I had tuberculosis. So that kind of changed my perspective on life a little bit, because how in the world would I end up with TB? Nobody really knew where I got it. I had spent some time in Denton on campus that summer. I had spent some time in the Los Angeles area that summer, and I had spent some time with my parents and my family in East Texas. So I never could really pinpoint where I got TB, but it definitely changed my life, especially my career path. When I went to TW, I was a nursing student because Texas Women's University is known for having a great nursing school. After my experience with TB and being in the hospital for 12 days, I realized I didn't have what it took to be a nurse. I didn't want to work quite that hard. So I also had a wonderful nurse that brought my meds to me from the health department. Her name was Celia, and she was actually the director of the public health lab of East Texas. And she would bring the medicine to me because she lived close to my parents' house. And in that time, she said, you know, you're not contagious anymore. Would you like to go with me to the CNE program? It's about TB and what nurses need to know about TB. And I said, sure, why not? That was my introduction to public health. I learned so much during that time. And I really started thinking, how could I have a career doing this kind of work where I'm teaching people about how to prevent infectious diseases? And I really got interested in epidemiology. But something else pretty significant happened that fall of 1999. These two people you see in the middle are my parents. And my dad is still living. He's 76, and my mom passed away almost 7 years ago. And in the fall of 1999, she had her first of 5 heart attacks. So that made me wonder, why in the world is this woman that's just so sweet and caring and giving, why is it that she's having a heart attack at, I think she was probably about 55 or so at the time. So she was relatively young. And what I learned later on as a professional health educator is there are a whole lot of things that she wasn't doing to take good care of herself. She was a long-time smoker. She wasn't overweight, as you can see in this picture. She had heart disease, high blood pressure. She had a family history of heart disease. Both of her sisters actually passed away before she did from heart disease. So that leads to my third picture, which is the heart, or a heart disease awareness picture. So why public health? It's because it's a passion of mine. 137 Black women die every day from heart disease, and my mom was one of those 137 Black women. So I've committed my professional career to spending time educating Black women about the importance of heart disease. So not just my professional life, but also in my personal life, I feel like public health is a calling and it's a passion for me. Next, I'll talk about COVID-19, what everybody wants to talk about, right? So we've been at this a year, and I used to make Facebook posts that would say, like, on this 180th day of the COVID-19 response, or now we'd be on this 75th day of the COVID-19 response. What's happening? Well, testing and mitigation efforts are still in place and still need to keep going. If you feel like you or someone you know is experiencing symptoms of COVID, encourage them to get tested. We can't stop getting tested because that's the only way for us to really have a good understanding of the amount of disease in the community. Also, continue to wear a mask. If you are going out and about and in public, especially where there's large groups of people and people that you don't live with, wear a mask. I know Governor Abbott recently lifted in the mask mandate for the state, but it's important that we keep ourselves protected and other people as well. Practice social distancing as much as possible. So if you walk into Walmart and everybody is on the aisle with the bread, wait till they leave to get on the aisle with the bread and go to the next aisle. Limit non-essential travel, and I don't know if you guys saw, but there's a lot of news stories about all the spring breakers in Miami right now and how they're having to use the police to disperse them. I got a chance to see the video this morning and it kind of made my heart race a little bit. And I imagine whoever the health department director there is having a mouth stroke, because that's just a nightmare waiting to happen. So try to limit your non-essential travel. And if you do travel, make sure that you're staying safe while doing so. A little bit about the COVAX efforts across McLennan County. The vaccine efforts continue weekly. We have a wonderful joint partnership between public health and the healthcare sector to make sure we're getting a lot of vaccine out into the community. McLennan County has 2 hubs, one being the health district and the other being the Providence Hospital. And with us having those 2 hubs, we're getting a lot of Pfizer and Moderna vaccine coming in. If you want to get vaccinated, reach out to your primary care provider. If you don't have a primary care provider, visit covidwaco.com and get on our waiting list so we can get you vaccinated. There's limited amounts of Johnson & Johnson vaccine in the community right now, just because that's such a new vaccine. It's taken a little bit of time to get in the production rolling, but as we start getting more and more Johnson & Johnson vaccine, we'll use that vaccine to target some of our most vulnerable populations, including homebound seniors and our homeless residents, because we want to make sure that those that can't take care of themselves are taken care of. And again, once you have an opportunity to get vaccinated, take advantage of that opportunity and get vaccinated. There's a lot of vaccine hesitancy, but if our leadership around the community is getting vaccinated and letting people know they're getting vaccinated, that will really help us at the health district with making sure we're getting people vaccinated. So what's on the horizon for the health district? I want to say that I know, but I really don't know, because this first 3 weeks, I've just been trying not to drown in COVID. But I do know a few things I've already talked with some of the leaders about, and that's expanding our partnerships with community-based organizations, healthcare, the FQHCs in the area, and the faith community. We know that when all of these entities work together, we end up with a well community. We're going to do data-driven program development. We won't just be grasping at straws. So if there's something that you would like to see happen with the health district, let us know. You know, send insight through any of our board members, email me directly or any of our staff, and we can see if the data supports that. Because what's happened over the years, not necessarily within McLennan County, but just across public health in general, a lot of times we do programming because that's what funding is available. But I promised Deidre and Bradley that moving forward, we will look at the data and let that drive what we do within the health district. For example, if we know that we have high incidence of stroke in a certain zip code or a census tract, well, we're going to take that data and then target those communities that have that high incidence of stroke. And we're also going to take that data and talk to our healthcare community about how to address these incidences of stroke, because it's not just about the direct service, it's about creating policies and developing strategies to address stroke, for instance, at a base level. We're going to work with other city departments to make the healthy choice the easy choice for Waco and McLennan County residents. I'm excited to work with our new police chief, because I think she has a whole lot of ideas about how to do community policing in a way that makes residents feel included and taken care of and seen. And equity and inclusion is high on the priority list for the city right now. So look for us doing some joint projects with her and with Parks and Recreation and other city departments, especially in county departments as well, to make sure we do that. That's all I really have. Not too much, Ashley, but I'm willing to take questions. So,
Okay. Well, thank you, LaShonda. I think you can.
Let me unshare.
Yeah, you can unshare. I think one of the things that I wanted to ask, I'm curious about, and there may be some people on the call that are also curious about, is like a public health district seemed to take an elevated role during COVID. It seemed like there was a lot that was put upon the public health district. Can you talk about in general what a public health district's job is to do? Like, what are the main functions? How does it interact with the community? And then how is that different now based on, you know, your experience in COVID?
So prior to COVID, us public health people were a little bit ignored, to be honest. Nobody knew what was happening in public health prior to COVID. So it's been great to see our staff, especially our epidemiologists and our preparedness staff, get some of the recognition and shine that they should have been getting all along. But typically in public health, the role is to just make sure that safety social net is there as much as possible and to facilitate and coordinate some of the state level programs, including like the Women, Infant, and Children program, the Texas Vaccine for Children's program, or the Adult and Adolescent Safety Net Vaccine program. Usually environmental health, so making sure the food inspectors are getting out to do the inspections in restaurants that we all enjoy, and making sure camps and daycares, things like that, are inspected. And then some of our infectious or communicable disease work includes like TB elimination and HIV and STI testing and treatment and service coordination. So it's pretty high level work typically, and we interface with healthcare, especially on those infectious diseases, mainly by being a referral source both ways. The referral goes both ways. For example, if we get a new STD infection, specifically syphilis, that's typically what we do public health follow-up on, or a new HIV case. We'd want to make sure that, especially an HIV case, would be connected or linked to services. So we try to get them in with the infectious disease doc or healthcare provider that treats people with HIV so that they can get their viral load to an undetectable state so they become less of a risk for themselves or their potential partners. So it's a lot of referral and back and forth. The Women, Infant, and Children's program, WIC, is a standard and a staple in communities, and we all know how important the first 5 years of life and having a good selection of whole and healthy foods is for pregnant women and those, young babies and children. So it's a lot of fun. It's all over the place. It's hard to describe. So, but I'll be happy to.
Yeah, what it sounds like is that the state of Texas or the federal government sometimes has priorities, and so you automatically receive funding and are responsible for things like WIC and things like certain kinds of infectious diseases. You are sort of the point for that. And then there's also ways that locally, if there's a need locally, you can apply for grants and then target specific things. So you kind of do a mix of between local and federal and state.
Exactly. And I like to explain it this way. Academia establishes the evidence base. So at university hospital systems or universities, that's where you see the research being done, where they determine what the best practice is. And then CDC or NIH usually validates the evidence base. And they say, okay, what happened in academia is accurate and correct. And then by the time it gets to local health departments and regional health departments, we are implementing that best practice. So it's developed, established, and implemented. That's kind of a easy way I like to think about what happens in the public health practice.
So we have some questions that are coming in.
Okay.
One is, how many people are currently on the waiting list? Do you happen to know that?
So our wait list is pretty much down to less than 1,000, I believe. We started out with a huge waiting list, and over the past 11 weeks, that team has just powered through it with the support of the IT department. We stood up a scheduling system that helped a whole lot, but it's less than 1,000, I believe. Don't quote me on that, but it's gotten pretty low. So at this point, we're still adding people to the wait list, and it really is based on where you fall on the phase. And you guys know that we're at the point where we're at phase 1C. Any adult over the age of 50 is eligible for vaccine. And if you work in, or if you work in a childcare setting or a public school setting, you're eligible for vaccine.
What about people who work at the Salvation Army? We do have James Taylor from the Salvation Army here. He wants to know if the frontline workers in the social service arena, such as Salvation Army shelter monitors, are eligible to get the shots, and if there's a way for that to happen.
I wonder about that. So James, if you will send me an email offline, we can see about connecting you all with someone who may be able to get your staff vaccinated, because we know that there's a need, especially with them interacting with people that may not be protecting themselves from COVID infection.
Okay. And are you comfortable posting your email in the chat box?
Yeah, for sure.
That way he or other people that might have questions for you can reach out to you after the meeting.
For sure.
Here's another question from K. Paul Holt. If one is going to finally travel by air, where do they go for the 72-hour test? Is there a fee? Do you know that?
I'm not sure. I think that you can get tested at CVS, and most of the national pharmacies are doing testing, and they should be able to do an antigen test, which is a faster response, or I'm trying to think of the brand name of the test that is like a nose swab, and in 15 minutes you can have a result. So I think there's some options available. I don't know exactly where in McLennan County you can get that, unfortunately, because I'm just not quite familiar enough at this point, but we are not doing any rapid testing. Someone put in the list Premier ER in the chat, so that might be an option. But I know if you do want a fast test, ask for antigen test instead of a PCR, because the PCR test takes a little bit more time to get back. And then somebody else says Premier is expensive. So that's what I read those dollar signs to mean, at least.
So I think maybe we're looking at, you've got a quick test, but it's pricey, and then you can still get tested through the public health district, but it's going to take a while, and it's not going to be.
Yeah, it just takes a little bit longer for the PCR test, which is the gold standard of the test, because it's going to be able to tell you at the earliest state of infection if you've been infected or not.
Okay. I don't know. We'll give it just another couple of seconds here to make sure that there's no final questions. But we do appreciate your you're coming to Waco. We're going to be glad to have you at the helm of the public health district.
Thank you.
And appreciate you. I know that before, as we were coming together on the call, LaShonda's actually got 2 children that are still in school in Tyler, so she's juggling back and forth between Waco and her new community and her old community, and also all the while dealing with vaccine implementation and managing public health. So it's a big job that she has right now, but it's nice to see your face and hear your voice and know that you'll be a part of our community looking at June. We hope that it was helpful for Rotarians today to hear a little bit about what we're talking about with our local situation, and we'll look forward to seeing you more in the community in the future. Looks like Janet just posted for everyone that they are continuing testing drive-by on College Drive, not the rapid test, but they expect it to be available Monday through Friday, 8 to 5 for the next several months.
And I think that test has about a 48-hour turnaround if that's the test. So the good thing, what I've noticed about Waco is similar to Tyler. I see the same people on all the calls, so I feel like I have all these friends. And me and Dr. McCall have been on a few calls together, but I think that's a turnaround of about 48 hours. So
great. Okay, and then you can see, James, you can see that LaShonda posted her email address there, so hopefully you guys can connect afterwards. We do end the meeting pretty abruptly after it's over, so we want to make sure that you've noted that, because you can go back and watch it in the future, but it's a couple of days. So there's not a lot of chat that goes on after the meetings. But that was a great presentation. It was nice to get to know a little bit about your history and background and what you're interested in with public health. We look forward to your leadership in our community, and hope that you have a safe transition, and that you help lead us out into a future that's where COVID is something that we're dealing with, and something instead of something that completely controls our lives. So thank you very much for agreeing to come to Waco.
thanks, Ashley.
We have a couple of slides before we close out our meeting here, just to talk about, I know that we are now looking at a time where we've got a lot of Rotarians who are vaccinated now, because we have an older club. So that benefited us, and that we had a lot of people that were getting vaccinated. But we just wanted to let you know the board is evaluating plans for resuming live meetings. We've been talking about this since we had to stop last spring. It's talked about at every board meeting, and the officers continue to watch this on a regular basis. So we will be evaluating our plans for resuming live meetings, and we know that there's several of you that are very interested, and we're obviously very anxious. I don't want to be a president who never has a live meeting the whole time that she's president, but that may be what we're looking at. But we need to make sure that we can meet when everybody's safe. I wanted to let everyone know we are using CDC guidelines and McLennan County's positivity rate as our guideline, and we have not dropped below a 5% rate as of right now. So we're watching those times where it gives you indication that it's safe for doing things like that. Our vaccination rate is changing a little bit, but as March 15th, it was 12% of the eligible population. And just know that we are looking at when we can meet live and what we can do. And when we do, we're looking not only to resume our meetings, but to make changes that attract those younger generations. So the board and officers have been busy this year looking at options and what we need to do in the future to make sure we have a vibrant club. So in April, we're hopefully going to have some plans to present to Rotarians and get the opportunity for some feedback about what we're looking at. And I'm saying the end of day to the 1st of July, that should actually say July. We're not going to promise anything about when we're meeting live. We have to make a call today based on what's going to happen. And we do have all those volatilities that we just heard from LaShonda about things that are happening that could impact us. But so we'll just be watching those things, but we'll be looking at certainly not going to be doing that now until we have more vaccinations and more people where it looks like that we're able to look at safe. But we're looking at those and we'll do it as soon as we can. But in the meantime, I put our caterers up here that a lot of people really enjoy. Rotarians who are vaccinated and who are comfortable going out are encouraged to meet together in small groups, just like the CDC guidelines say, is you can meet with other vaccinated people who are fully vaccinated in controlled conditions. And so you may be wanting to go to these local restaurants and support those businesses that we normally do and engage in fellowship. So I was just going to say, you know, when you want to follow safe things, we're not encouraging people to do anything that is not safe, but you can think about getting together on your own and on Mondays when we normally meet and talking about how you can contribute to your community. So we'll be in touch with you as soon as we have anything more on live meetings, and we appreciate everybody's patience, but please know we're not avoiding this. We want to meet live too. We know that this is a substitute, but it is not the same as the live fellowship that we get in our meetings. So we want to do that as soon as possible and engage our new Rotarians who haven't been able to meet ever live in a live meeting. We hope to be able to do that very soon for you. And we'll keep you posted about that. The last thing we do as Rotarians is we do the 4-way test. And normally we say this together, but I'm going to say it and you can follow along with me. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? I want to thank again our chair of the day, Diane Sawyer, and our new director of public health, LaShonda Malrey-Horne. We thank you all for joining us today, being patient as we deal with virtual meetings. And we'll see you again in April. Rotary is adjourned.